I'm speaking to Larry Bauer about our Family Medicine Diabetes Endowment that we have here in Cox Medical Center at Springfield, Missouri. I met Larry at an STFM meeting several years ago, and he told me that if we were going to do all the things we wanted to do to improve care for people with limited funds and many chronic diseases, that an endowment would really help. So I went to his endowment seminar in San Francisco, I think 3 years ago. And we had big ideas. When I heard how easy it was, we thought, well, we'll just go ahead and get $1 million endowment and we'll start really doing some big things in our program. But we did have $100,000, and we started giving small awards, $500 to $1,000 awards, mostly to our clinic staff, people who got interested in our efforts to try to improve the health of people with diabetes and chronic pain and depression. Little endowments did big things in our clinic staff. It really started people getting excited. Even appointment secretaries were figuring, what can they do to help improve the health of our patients? Nurses were thinking, how can we get all those foot exams done with people who have diabetes? And we started funding teaching sessions, trying to help people learn self-management skills. One endowment was for $1,000 to put on a healthy Thanksgiving dinner for our chronic condition patients with diabetes and hypertension and depression, and feed them healthy food as a Thanksgiving dinner. And we had a great turnout. 45 patients came, and we were able to talk with them about healthy eating, and it was a great time for all of us. A little later, some of the nurses said, you know, if we got little socks for people, they'd be more likely to take off their shoes during the winter time when we're trying to get their diabetic foot exam done. So we bought some socks that are kind of nice, and actually a lot of our patients wear them as their regular socks because some of them were a little short of socks. And it wasn't a lot of money, but it really increased our satisfaction and excitement, and we got our foot exams numbers up over 90%. We've learned that chronic pain patients can help themselves a lot, not just by taking another narcotic, but by journaling, writing about their pain and telling us more detail about it, telling their stories, and writing details of how they want to change to improve their health. We just passed those out yesterday. They're nice embossed journals that have My Journey Toward Better Health and the patient's name on it. Little bits of money that have made a huge difference in our program. We're now a level 3 patient-centered medical home. We're applying for Center of Excellence for care of people with diabetes because we've made NCQ a criteria for that little award. There's a lot of enthusiasm, not just among the doctors, but among the entire family medical care staff that wants to help people and has found out that they can do it a lot better with a little bit of money. Thank you, Larry, because it's made a difference in our program.